But are these three nutrients important, or do we need other micronutrients? Now, what is important is that the commonest question what the patients normally ask to me is that what should be the diet, what should be the nutrition, and in pregnancy are the nutritional requirements different or are they the same? So a very simple explanation is that pregnancy comes with some kind of its own symptoms and havocs, like a lot of pregnancy induced symptoms. They could be nausea, there could be very little intake of nutritional food by the woman. There could be altered taste, and later in pregnancy there is dilutional anemia too. So overall what happens is that pregnant women, yes, can be nutritionally deficient. So traditionally, ever since we have been in medical colleges, right from our teaching, what was really important was that pregnant women were given three important, supplementation. One was folic acid, then came iron, and then is calcium. So the question which arises in modern era, sitting in 2025, that is only supplementing folic acid, iron and calcium enough? So let's get into certain details of what is essential and what is preferable, and I think what should also be added when it comes to pregnancy nutrition. Now, of course, most important is the diet, which cannot be overcome. So a nutritional or a balanced diet is absolutely important and the crux. But diet may not be enough, to supplement certain nutrients, and so comes the role of folic acid. We know that folic acid gets converted to another molecule, ultimately to tetrahydrofolate, and which is required for the brain development and the neural tube development of the baby. So it is important. And in the first 3 months, in fact, we tell the couples, if they come planning for pregnancy, then yes, 1 month before conception they should start folic acid. So it's essential in the first 3 months, and then comes the role of iron. Now very important is that yes, they do take iron. Now most of the formulations of iron tablets, we know that in pregnancy only maybe 10 or 15% of iron would be absorbed, and the rest of the iron preparations are not absorbed, and that is of course required because nutritional anemia is one of the commonest reasons, and in India we have a tremendous load of pregnancy induced anemia and its further complications. Third comes is calcium, which is required for the bone growth. But are these three nutrients important, or do we need other micronutrients? So as the pregnancy advances, we also need other nutrients like vitamin B6, B12, we need DHA in the second trimester, and there are many more micronutrients which are required for the brain development. They are required for the cognitive function. Some of the micronutrients may help in overcoming, though not totally, I would say, diabetes or hypertension, but supplementing micronutrients can help in replenishing those deficiencies which were present in pregnant women, and sometimes women who are exclusively on vegetarian diets, they may be nutritionally deficient, because in India I would say 50% of our patients are vegetarian or even more, so they might need more supplementation. So overall, yes, I think even now ICMR, WHO, they do recommend that adding micronutrients to our normal supplements what we are giving to the patient could be beneficial.